Right, as you gather, my name is Brian O'Connor. They give me this slide to carry around with me in case I forget who I am. My wife also has one at home and says staying long is usually the expression on the pillow in the evenings. What I want to do is just spend a few minutes telling you, can you all hear me by the way, if this mic's working? Yep. Tell you, first of all, to say you're not alone, as the saying goes. This ecosystem is part of a growing international network of similar ecosystems in different countries. So for example, next week we have our Scottish Ecosystem quarterly meeting. Just a few weeks ago I was in the Belfast one. A few weeks before that in Nice in the south of France. And yes, you can apply for my job if you like travelling. And also, of course, we have just had an ecosystem meeting in Finland, in Oulu, in the north of Finland. And we reckon by the end of this year, at the very latest, we'll have 25 of these ecosystems throughout Europe. They will meet quarterly, as this one does. That means that you're going to have 100 meetings a year in Europe of multi-stakeholder meetings. Because we all know by now that one of the biggest problems and obstacles to progress are the silos which have bedeviled the whole health systems, not only in this country, but everywhere, where people don't know each other. And I know I recognise a number of the faces here who come regularly to these meetings. And I'm sure you would agree that just the fact that you turn up, the fact that you start to get to know some people that you did not know before, you build the relationships, you start to build trust, and then you start to do business. And this sort of meeting is, as I say, replicated in many, many places throughout Europe. So anyone who's a member of the ECH Alliance can actually attend any of these ecosystems anywhere. So from an industry perspective, and a particular offer to startups and SMEs, anyone who has a company with less than £500,000 of revenue can actually join us for free. So that gives you the opening to come to meetings like this elsewhere. Universities join us for free, and generally not-for-profit organisations are welcome to join us for free. We ourselves are a not-for-profit community interest company. So we survive on membership fees from large companies, from other income, and our objective is to break even, but above all is to break down the silos which are holding us back. So you're more than welcome. Liz, who's just joined us, the other Liz Ashall-Payne. Seems to be everybody in the Northwest, many ladies in the Northwest seem to be called Liz, Lisa, or something starting with L. So, you know, you have a fair chance of just using Liz and you're pretty well all right. So Liz Ashall-Payne is here today and we'll be more than happy to talk to you about membership and so on. What I want to just give you is 3 very quick examples of initiatives happening in 3 different ecosystems, all of which may be relevant to the Northwest. First, in Oulu, they have created a citizens platform on your smartphone or iPad where you can book your doctor's appointment, where you can receive your blood results. You can do all of that online. And they have something like 200,000 people already using that. And Oulu is a place where the health and social care are joined together and operate under the mayor's office, because they operate very much in municipalities in Finland. They want to export that expertise and knowledge, which is a combination of the health service and local companies. Now there's an example where we would like to be able to transfer that, not just best practice, but real success stories. And so that's something we'll be putting on our website soon, because they want to look for partners from outside Finland who can add additional functionalities and apps and so on to that platform. The second one is one that Liz touched on, which is in Northern Ireland. The challenge from the Northern Ireland Department of Health was, in terms of medicines adherence, they at long last worked out how much it was costing them a year. They'd never done the sums before. Ever since it was created, the Department of Health have never worked out in Northern Ireland how much does it cost if people do not take their medication. They knew how many bed nights there were, how many ambulance visits, etc., etc. They've never actually reduced it down to a real figure. They eventually did that. They accused us of not allowing them to speak at an ecosystem meeting till they did that sum. They were shocked when they realised that £112 million a year in a small place like Northern Ireland was the additional cost to the health service. Now, many of you will not be surprised at that, because this is a universal problem. They then stood up and said, our normal horizon scanning and procurement procedure, if we really move at fast pace, will take 3 years. 3 years. Some of you may know that in many cases in the NHS, innovation, as it's called, can take up to 18 to 20 years. Which in my head at least means it cannot be innovative. What they did was they used an ecosystem meeting to present the need, the problem. We had 200 people in the room, 65 startups and SMEs, plus multinational companies. And then we called a round table. Because we are neutral, we're not going to bid for that contract, and because we're not the government, we can actually call meetings which do not breach procurement rules. They're there, we may not like them, but we have to stick with them. As a result of that meeting, the chief pharmaceutical officer said, I reckon that meeting has just saved me 300 to 350 million pounds, because we actually telescoped the time it takes for them to understand what's in the market, to be able to describe it, reduce it to writing, and procure it. Within 6 months of the first ecosystem meeting, they announced the procurement under an SBRI programme, which, by the way, was the first ever health SBRI programme in Northern Ireland. What we then were able to do is that phase is coming to an end in June, and they've already got the funding for the next phase. As you know, with SBRI, they start with quite a large group and they reduce it down. They've already got 4 other specific issues to be dealt with under SBRI using the same methodology. Now, those are huge sums as far as Northern Ireland is concerned. You know, the total budget there is already in deficit by a couple of £100 million at least this year again. Even if they only save half of the 112 million a year, think of the human advantage that gives to the people who suffer. They don't want to go to hospital in a blue light flashing ambulance in the middle of the night. The hospital administrators don't want to have to postpone operations and tell people they can't come to the hospital because other people are taking up the beds. Nobody wants that to happen, but it does happen. So that's another one. And the third one is one which is about to be announced publicly. It's not confidential, otherwise I wouldn't tell you, but there's a huge project in Barcelona to combat loneliness in the city of Barcelona. Because you'll all appreciate that one of the loneliest places in the world is a city. People think it's because you're out on a mountaintop somewhere. I think a lot of people who live on mountaintops quite like the loneliness factor and get away from it all. But in fact, the biggest issue, and I'm sure you've got the same issues here, I know they have it in Scotland and other places. So this, interesting enough, this is being funded not by the health service, but by the Bloomberg Foundation, who have tasked the ecosystem in Barcelona with Tic Salut Fundación and a few other organisations to combat loneliness by the use of smart technology and services and learn from others. So again, that'll be going on our website saying, here is the need, here's the timescale, we would like companies and others to step forward and say, we know how to deal with that problem, or at least an aspect of it. So this is what we're always trying to do, is to keep these, if you take those 3 practical examples, they're now being spread throughout our ecosystem network to eager recipients. And my, not challenge to you, but my encouragement to you in this ecosystem is to do the same. You have done some amazing work. I mean, the thing that Liz referred to, the Warfarin thing, a friend of mine has been on Warfarin for 35 years. I live in the Isle of Man, as some of you may know, which you would think must be a good health service. There's only 80,000 of us, must be easy. It isn't. When he first started to go to the Warfarin clinic, there was 1 part-time nurse. There are now 11 nurses doing Warfarin clinics every week. And he's saying to me, why do I have to keep going there? So he's gone through the same process you and your husband have gone through. And you think of, there are simple solutions which, if people knew about them, could be implemented. And we could break down the I don't know, the culture sometimes that stops innovations being accepted. There's a shortage of nurses in the Isle of Man. Why do you need 11 nurses to do this? So they should be dealing with the exceptions and the issues rather than the norm. Because in almost every week, he's fine. So these are the sort of things that you're looking at here. Please understand that these are not and should not be only for the benefit of your citizens in this part of the world. You should be packaging those up, exporting them. And we are offering you, as part of our ecosystem network, the opportunity not only to export them in general, but to go to other ecosystems and present what you have done as success stories for other ecosystems to embrace. That'll help you. It'll also help companies who are working with you and allow those companies to develop a bigger business and bring economic development and jobs to this region. These are not pipe dreams, these are real things that are happening. So moving on to say that we're going to continue to build that ecosystem network. I think I have one other slide, I believe. Yeah, I only do 2 slides. China, lots of people are asking about China. As you know, we're now growing very fast in Europe. We were asked about 7 months ago now, I think, by the Ministry of Health in Beijing, who were on one of their many visits to Europe. They love traveling. We met them. I was asked to do a short presentation, which I did, and they said, in typical, I have to say, Chinese fashion, and I know some of you have just come back from China, and so will know this. As we finished we said questions. First question was, can we do a deal? And this was from Dr. Gao, who is responsible in the Ministry of Health in Beijing for all electronic health records, health informatics, for the whole of China. Sitting in the front row, and she says, can we do a deal? Which I have to say is not the sort of question you normally expect after a presentation, though it's very welcome. I said, it depends, was my usual answer to anything. She went, well, you need to come and set up the China Connected Health Alliance in China. We don't have it. We need something like that. Because all your talk about silos, we know. We're dealing on such a huge scale. Our silos are really big and really strong, and we just cannot break them down. So as a result of some negotiations, we opened our first office in Shanghai about 3 or 4 months ago now. As a result of that, our first members in China for the China Connect Health Alliance are the Ministry of Health, the Ministry of what I call Social Welfare. It used to be called the Ministry of Family Planning. They're rethinking that policy significantly. The Ministry of Public Security, which is important because it deals with the ID cards. Now, if you think of 1.4 billion people, everybody has to have an ID card in China. You don't get any services of any kind, but at the moment, it's just a plastic card in most cases. They want to digitize that. They want to put all sorts of services onto it. And we're in negotiation with them at the moment to encourage them to put a patient summary record on the digitized card. Think of the impact that could have. They're very keen also on another aspect, which is dealing with the 280 million people in China who are over 60. So the 280 million people over 60. The frightening statistic is not that one. The frightening statistic is that there are more people over 60 than under 15. Think of the implications of that for future economic problems. They've already got problems. You would think, how can you have a problem with 1.4 billion people? Well, the workforce is a lot smaller and getting smaller. The number of people who can support the elderly financially is therefore smaller. And because of the one-child policy, they're having to relax that, and mainly in the rural places. In fact, interestingly, when I was there about 6 weeks ago, first guy I met said, come round to my home and meet my family. So I thought, meet the family, meet the child. No, we met 4 children. I said, are they all yours? He said, yes. I said, what happened to the one-child policy? He said, oh, that applies in different places. It just doesn't apply in my home. And though it's rigidly enforced in certain parts of China, it is not rigidly enforced across China because they recognize the economic problems they've got. So what we've done is they're our first members. The group that just joined us just yesterday was the China Doctors, what I call the Doctors Association, 600,000 GPs and specialists. The China Hospital Association, 10,000 hospitals. out of the 91,000 hospitals in China. Now, we all may say, rather sniffily, as someone said to me in London the other day, it can only be in London that say this. I say that as a guy from Belfast, so you can appreciate that maybe. He said, oh no, what they call hospitals are not hospitals. And I said, by our standards, you're probably right. But if that's the only place you can go to be treated, you go. We had a very interesting, this same Dr. Gao came to Barcelona in February to speak at the Mobile World Congress, where we were running the health and wellness part. And she amused the audience by saying, we have 91,000 hospitals in China, as far as I know. It's pretty close to 91,000, but it's difficult to keep count. And the message to you is we do not have enough hospitals. And of course, we're all sitting going, I mean, come on, we're trying to reduce the number of hospital beds. So they're very different issues and huge numbers every time. So what we are doing is we're trying, by using the China Connect Health Alliance, we're creating what I call qualified opportunities. Anyone who's been to China, and I know Chris has just been there recently, and we'll speak in just a moment. When you actually go to China, and I lived in Hong Kong for 12 years, and during that time I visited China every second week. And I still don't think I'm an expert in China because I've been there 200, 300 times, whatever it is. But what I've realized is that the Chinese have realized something, and it's taken a while. That first they had to build their hard infrastructures, they call it. The bridges, the roads, the tunnels, the airports, the bullet trains, all of those things, which I can tell you now, far, far, far surpass what we have got in this country and many others. So anyone that tells you they're in the, not even the last century, the century before, living in hovels, some may be, but I can tell you every flight was on time, no aircraft was more than 5 years old, right? Everyone I dealt with spoke English. The bullet trains went on time. The hotels were superb. Everyone seemed to have a smartphone, 600 million at the last count. Right? So there is a market there, and what they've realized is they've done all the hard, not all, but a lot of the hard infrastructure. They're now turning their views to what they call the soft infrastructure, which by that they mean the medical and the social care. We all worry about China in terms of its growing power militarily, its human rights situation, etc., etc., etc. The majority of people in China worry about one thing in China, the lack of good medical care. That's their biggest worry. I don't mean to discount all the rest. I'm just saying if you want to look after your family, you want to make sure they can bring them somewhere worthwhile. I was in a hospital in Shanghai, 5,000 people, 5,000 people in A&E that day. I don't mean over a month or a week or a year. I mean that day. Take a number and wait. They're trying to address those problems urgently because their attitude, publicly they say, we want to avoid public disquiet, which is code for if we don't sort this out soon, there are a lot of people who are going to be really angry at us. So they're trying to sort it out. They're pushing hard to change their new 5-year policy, a different way of paying for all of this. They're not short of money in China either. So what we're trying to do is embrace that, become the trusted partner in China for people like yourselves and others, and try to pre-qualify real opportunities. So when you go there, you don't go just to look at China and go, wow, right? You can do that as well, because it's good fun, but you actually need to get into real business opportunities. So just to close, later today, the ECH Alliance will be publishing, we've already announced that we're going to do this, but we're publishing it today, following final negotiations last night, our ECH Alliance Health Mission to China, as you see. And it is effectively a 4 days of, warn anyone who's thinking of going, really, really, really hard work. I have to warn you, because what we've done there is assemble the senior officials from the ministries I've talked about who've agreed to come to Shanghai and spend all of that day with people who are visitors from the West, as they call it, to explain what the 5-year plan is, what it means when you drill down to the lower levels, and what they need, because they have accepted they don't know everything. They've accepted they need us. Therefore, we're trying, so that's the ministries. We have a number of specific Chinese companies who are involved in, for example, training, for healthcare workers, for nurses, healthcare workers, doctors, domiciliary care workers, etc. Many people, of course, these elderly communities they're creating in China, called the I-Want centres. There'll be 31 of them already approved. I visited 2 of them, one in Beijing and one in a place called Ningbo, where they're going to have 20,000 people living on that site. Because they have to deal with numbers like that. They can't just say, oh, we'll put 500 people there. Well, come on. That's not just a drop in the ocean. I'm not even sure it's a drop. What is a droplet, I suppose, is the lowest one. So just to say to you that when you go there, you realise, of course, that these homes are not being built by the government. Oh, it's you, sorry. They're not being built by the government or paid for by the government. They're paid for by the people who buy the houses and the villas and the apartments, or by their sons or daughters. So there's a huge middle class, as it's called in China, which we might sniffily say, if you're from London, excuse me, anyone from London, you might say, well, but their income is so low. It's all relative. And the fact is they are selling these things off the plans. And they want people to help them kit out and fit telecare, telehealth, etc. into their homes. They want monitoring centres. They want wearables, right? They want to build on that side an academy to train the very people who can then look after the community there. They want to build a hospital on the side. We're helping them spec it at the moment. So these are real opportunities which we want to present in July to you. So if anyone is interested in going in that mission, I know a number of you are, and we have people coming from the US, Canada already signing up, and people from across Europe. The idea is that we want to make this a visit which is worthwhile. You can come earlier or stay later and do your sightseeing, and I would recommend if you've got the time, please do, because it's worth seeing. But those 4 days will be intensive, and they include the digital health event at what is the Mobile World Congress in Shanghai. It's the first time ever there's been a health element to that Congress, just as we were the first to do the health and wellness element at the Mobile World Congress in Barcelona. So I encourage you to have a read of it, have a look at it. Don't go, don't sign up if you think this is going to be a pleasure trip. Please understand, we want to make this productive and worthwhile. We'll try to pre-qualify, introduce you to people, and then it's up to you. So that's a very, I hope, quick summary of where we are as ECH Alliance, where we are as CCH Alliance, and we're delighted that this ecosystem, the 4th one in the series, has actually become just a permanent reality and a part of your infrastructure for dissemination, for delivery and support, and above all, building relationships. So we encourage you to join us. Those that are already members, I know a number of you are here, so welcome. Do feel free and able to come and visit our other ecosystems as we open them up. I know some of you already visit the ones in Northern Ireland, for example. Do come and visit and engage with similar people in different countries. Thank you very much for listening. Thank you.